It being 10 o'clock, excuse me, I will call to order the Thursday, September 4th meeting of the Criminal Justice Committee. I assume all members have had a chance to read minutes of the previous meeting. If so, I'll entertain a motion to approve.
So moved.
Moved and supported during discussion. Hearing none, all those in favor say aye.
Aye. Aye.
Well, same sign, motion carries. Finance reports.
You will find your project income statement for the Criminal Justice Communications Allocation Fund in your packet, and you will see that you have a cash balance of just over 45,000. If there's any questions, I will attempt to answer those.
Questions to the finance report? Hearing none, we will move to the sheriff's report.
Good morning. You have my report, which is very brief in front of you. We have a couple people graduating Friday from the Washtenaw Academy. And other than that, I want to note that school's back in session, so if everyone can make sure and slow down and pay extra attention to the school buses. If you have any questions, I'd be happy to answer anything.
Questions to the sheriff? Very good. Hearing none, we will move to the prosecuting attorney.
Sorry, you have my report in front of you. Does anybody have any questions?
Questions to the prosecuting attorney? Very good. We're moving right along here. Public defender, I don't see here. We'll move next to emergency management.
You've received my report. First, I'll answer any questions if anybody has any on that before I move to the action request form.
Questions of emergency management? Hearing none, we have a request from emergency management. The request is the recommend the purchase of the M30T drone and the 800 meg radio in the amount, excuse me, of $23,960.67 to personnel ways and means. Do I have a motion to that effect?
I will make a motion to that effect. Support.
It's moved and supported. Is there any discussion? Would you like to explain?
Did you have any questions first?
I'll wait for your explanation.
So the drone is the same kind of drone that we used for the response to the downtown Adrian fire. So the main drone that we use on probably 90% of our call outs because it's got a better camera and it's got the infrared as well. So that'll give us 2 of those in our fleet, which will also then double our other accessories that we have as far as batteries and extra blades and chargers and things like that. And then the radio, our pilots, other than a couple who are command officers, none of our pilots have take-home radios. So when they respond to a call out, they have no way to communicate other than by phone with dispatch and incident command. So this 800 radio would have the county template on it, the emergency management template. So when they pick up the drone, they would also pick up that 800 radio and be able to communicate with incident command and dispatch as they're responding to the scene.
Bishop Van Dorn.
So a few questions. So currently we don't have a drone with an 800 megahertz radio.
So the 800 megahertz radio is separate. So that's just, so no, we don't have one that's with the drone.
Okay. So, okay, so that we didn't have an 800 megahertz radio at all.
Correct. For the drone team.
Okay. And so this is additional, okay. And then just for my information, I mean, what's the current fleet status? How many drones do we have?
We've got 5, so this would take us to 6.
And so this is kind of like a duplication of the one that we used at the fire. So, I mean, just trying to get a feel for how many drones we need here.
Well, the other drones are used for different things. This one's used the most because of the types of call outs that we get the most of, which is usually missing people or people fleeing the scene because of the infrared that we have on them. Our other drones are smaller. are more maneuverable. We've also got one that can be used indoors where these can't because they're too big. And then that gives us the ability, especially during special events where we stage, like during the race, we staged the M30T up at MIS. And if we have a call out, then we've got to pull that one from MIS to respond to that incident. And then that leaves us naked up at MIS.
Okay, so the need is that we've had that happen. We've had it where we've had one in service and we need to take it out of service to take it someplace else. So the reason for the duplication.
Correct.
Yeah, so now that we have, how many, 5 in the, did you say?
This will make 6.
Six? And is that gonna pretty well cover us for our needs?
I do have one more that we're looking at getting, and it's an underwater drone. And I've talked to the Drain Commission about partnering on that. Cause it can be used to assist the dive team. It can't replace the dive team, but it would be used to assist the dive team for, a drowning incident, as well as the, Drain Commission, cause you could use it to inspect dams that are owned by the county without having to send a diver down.
Yeah, I just want you to know I'm very supportive of the drones and I've had conversations with the sheriff in the future of where we're going with drones and it looks like that's moving it forward. I'm just making sure that, we're utilizing them to the best of their ability and how many we need. I was just trying to get an idea. Thank you.
Mr. Krasny,
Point of clarification, was that 5 across county government or just your department?
So that's just our, that we use countywide. So those can be used by any agency in the county. Any incident commander can call for the drone.
Commissioner
Well, that brings out a good question. What other department, do we have other
Well,
departments?
we did one for the Drain Commission as one.
So, yeah, the Drain Commission has one to do surveying over fields for their county drains.
And spraying too, right?
But no other Cambridge Fire, I don't think they have one for the fire department. They've got fire personnel that have personal drones that they've used, but no other agency that I'm aware of in the county has an agency-owned drone.
Sheriff,
And as we talk about drones and as we move forward, I try to keep up on technology still. And really the way I just recently saw where I believe Oakland County is starting to deploy drones as first responders. And if you keep up on that technology and you keep up on that, that's coming. I mean, that's one of the technologies that as we continue to move forward, we expect to see that as it's being deployed more and more. So we're not getting away from any of the drones. If anything, we're heading more towards it. So, to your point earlier, I can see where we deploy it so much that I can see where there could be a opportunity where we'll have to have 2 drones out on something at the same time. So I applaud you for thinking forward and knowing that we have just really relied on these for a lot of things. So
We've also used more than one drone on one incident at a time as well. The sheriff's deputy in Hillsdale County, when he was shot and killed, and that suspect was on the run, they called for our drone, and we actually sent 2 over there to fly at the same time because they just covering large areas. And then also the sheriff's department does have a drone not included in our fleet that they use for accident investigation.
Just to highlight the funding source too, as all of you know, Emergency Management Director Tanis does really well with his budget and obtaining grants and things of that nature from the state. So during budget meetings this year, our finance team and the director were able to really work through kind of what those accounts in emergency management look like and realize that they had a significant fund balance from a planning grant that had been coming in. And so that's the funds that will be utilized to purchase the drone and the 800 megahertz radio.
Very good.
Mr. Rungst,
Just a point to go back to on the portable radio, just to be very clear, that portable radio really has nothing to do with the drone itself. You're just adding that to your department. or general use for anything, any incident, right?
Well, it would be used, so we have radios at emergency management. That radio would be used specifically with the drone team. It does not need to be there in order to run the drone.
Okay.
It's just so the drone pilot can communicate with incident command and dispatch.
Which goes over 800 megahertz.
In addition to the fact that this is grant funded, I think we'd iterate what you stated earlier. Purchasing this drone effectively doubles batteries that we have, extra blades that we have. So you could in fact extend by 100% the life of the time, or length of the time rather, that a drone can fly in the air simply by replacing batteries. Commissioner Van Dorn.
I know it's a lot of questions, but just for my information, I noticed on accounts payable, we paid for some new blades for drones. So what's the usage of those? I mean, how much usage do you get out of them before you have to or was there an accident?
It just depends, on conditions that they're being used under, but they could last, a couple of years, or it could be, if they bump something or when they land, the blades are not that expensive. So we try and always have extra sets of blades and they will eventually just wear out.
Thanks.
Other questions?
Also, just to clarify, this would be a not to exceed. I did receive another bid for a radio, that's not a Motorola radio, which is almost half as much. So the cost will actually be a little bit less than this. We'll probably go with the Kenwood radio. I don't know if that makes a difference on the request.
Commissioner Van Dorn.
But we're not sacrificing quality for better price, right?
No, you're just sacrificing an M for a K.
Further questions, comments? Hearing none, we have a motion on the floor. The motion is to recommend the purchase of the M30T drone and the 800 megahertz radio in the amount, is it not to exceed? Was that your motion?
Yes.
Not to exceed $23,960.67 to Personnel Ways and Means. All those in favor say aye.
Aye.
Oh, same sign, motion carries. Prosecuting, excuse me, public defender, we have him here now. Speaking to Mike.
This one right here. Turn it down.
Submitted from John Glazer. Does everyone have that report?
Yes.
There's been an increase of 47 cases on the felony and 41 cases on misdemeanor cases.
Questions of the public defender's office? Thank you, sir. Hearing no more, we will move to the medical examiner. Here you are on.
Good morning. I noticed that up on the viewer up there that they have the July statistics. Actually, I've been given the August statistics so that we're more current and up to date. So let me just run through that real quick here. The total cases for Lenawee is 202 cases. The autopsies that we have performed have been 54 to date. That comes out to be 27% of our cases that we investigate that we perform autopsies. That's important because our biggest expense in the investigations is the performing of an autopsy. So we try and keep the number of autopsies that we have to absolutely perform to a minimum. The projected number of cases for the year, I have projected approximately 303 cases with a projected number of autopsies being 81. Of the deaths that we investigate, 70% are natural, 21% have been accidental. On the sheet, you see primarily numbers, but the numbers don't always tell you the whole story. That's why I like to present it as a percentage. And of those that we have investigated, 67% were male and 33% female. And what's interesting under the cases per age, 85% are over the age of 50, and 27% are over the age of 80. So most of the deaths that we investigate are primarily, of the elderly. And of those, 50% occurred in a healthcare facility, which is either hospice, nursing home, or the hospital. And only 9% were actually seen investigations. Some of the other activities that our office has been involved with is that we've had multiple morgue tours. We've had a couple of Jackson County commissioners come in for a tour of the morgue in Jackson. We primarily function as a regional medical examiner's office, and so far our office for all three counties have investigated at least 727 deaths for all three counties. We are working, we're having problems in the morgue with our current vendor for mobile x-ray. Instead of sending them to the hospital for x-rays, so we're looking at a new vendor. And I'd like to thank emergency management for Lenawee, because they donated all of their protective equipment that they had for COVID and that to our office, and we're using it for our field investigators and for our autopsy staff. The other thing that happened is Jackson County Human Services Committee approved a full-time lead medical examiner investigator, as well as a part-time lead pathology assistant. These two persons will relieve the pressure and the time and work that Sarah and the rest of the staff has to do, because they're on the phone and performing so much office work that it will help our, it'll help because they don't have to maintain and supervise all of the field investigators. These people will be doing that. And then the other thing that I'd like to announce is I've worked with Craig and emergency management through MIS for multiple years. And on October 2nd, 1st and 2nd, I'll be in Saudi Arabia giving a talk to the 3rd International Conference on Mass Gathering and Emergency Medicine. It's an international conference, and I'll be talking about the history of mass gathering medicine in the United States and the impact on the impact it will have on the 2034 World Cup soccer tournament in Saudi Arabia. And then the second talk is on Michigan International Speedway, lessons learned in event medicine.
Impressive, Doctor. Questions to the doctor? Mr. Van Dorn.
I just have a little question in reading your report. When I'm looking at these, like total ME deaths at home for July, and it says 15 plus 4. What's the plus 4?
Hillsdale.
Okay, so
The second number, because the field investigators, since Hillsdale has an agreement with Lenawee to
Gotcha.
provide the services, so they'll give you the total number. But what we do is separate them out for each of the counties.
very good. Thank you. You probably told me that before, but I forgot, so.
Further questions, comments? Hearing none, thank you very much, Doctor. We'll move now to the courts. Yes.
Good morning.
Morning.
As of today, juvenile court has received 164 petitions for the year and 28 over-the-counter complaints. I'm happy to report that we have a great collaboration with our prosecutor's office, and we appreciate all your efforts, Jackie and team, to create diversion opportunities to keep kids out of juvenile court when they're first-time offenders, nonviolent offenders. I think that we're making a lot of strides in that regard. With the JJ reform, the laws have changed significantly that restricts the type of youth that can be detained, for the type of offenses that a youth can be detained on. And so using that detention screener and increasing all of our opportunities locally has been significant for our department. In addition to a lot of the youth incentive cards, you know, it kind of, it's hard to comprehend why we would give incentives to youth that are acting out. But if it keeps a kid from using on a weekly basis, just to give them a gift card to say, hey, we recognize the efforts that you're making. If it's stopping them from being suspended from school, they are working, just so you guys know. And, you know, we weren't in favor of them when the state recommended them, but they are working. We're working on trying to track, you know, it's kind of hard to track recidivism on a gift card. However, we are tracking reoffenses and how many new petitions each youth are receiving. So we are doing some, you know, some legwork that is time consuming, considering the JPOs are very busy. And now that school has started, we've had to be very active in the community and more present in the schools. We got a break away from that during the summer. However, the JPOs were in the community a lot in the summer as well, going to the fair and just trying to meet the kids where they were to deter some of the behaviors. Very proud of the team and the work that they're doing in creating opportunities and resources right here within the community to keep kids at home and out of detention. Although we love the detention and our work that we do with Rod and your team, we appreciate that as well. Just another update for the court is November is Family Court Awareness Month, as well as Adoption Awareness Month. And the probate court staff is working really hard to ensure that November 18th, the adoption day, goes smoothly. So I wanted to put that on your radar. Please come and support that. It's pretty big, and we've had quite a few adoptions and an increase in adoptions because of the work that probate court is doing. My colleagues in district court wanted me to update you guys to let you know that the Docket to Drive is underway, and that's the program that helps reinstate driving privileges for those that lost it as a way of a type of diversion as well. So that's what's going on with the courts. Thank you.
Mr. Van Dorn.
I really appreciate that information on the gift cards. I know the chairman serving on accounts payable in the past, that question comes up quite often when you're looking down through and reviewing those and the number of gift cards that are there. So I'm glad to know that you're tracking that and that it's working. Thank you for that information.
Thank you.
Further questions, comments? Yes.
So I appreciate you explaining the new changes in the laws with juvenile justice and reform and all of that good stuff, and appreciate you, Rod. We are trying to work with diversion programs, trying to get some of this youth the help that they need. However, we do recognize that there are some cases where they're not first-time offenders, or they're violent with family members, violent with teachers, violent with law enforcement, and that we're not okay with that. So I just want to make that clear.
Very good.
Thank you, Dan.
Further questions, comments?
I have one comment to make in regards to that. We stand in solidarity with you guys, as we're not okay with it either. But it is the screeners that the state is mandating us to use is now under fire. And so the state, MDHHS is recently opening the opportunity for another screener to be used. But until then, we were told for the next 18 months at least, we will be required to continue to use those screeners. And it's 5 questions. And I'm not in favor of it. It depends on who you are and how you answer the screener, because you and I could do the same thing, sir. But depending on whether or not my family has had interaction with police or how our personal feelings are towards the police, give us different results. I could get locked up for doing the same exact thing as you, but you could walk away. And I just don't think that that's fair. It's not equitable, and it's not a good practice. However, that's been challenged at the state level, and the state still decided to use that. So we are mandated to use it. And there's times that we talk with the prosecutors and we know that we're all on the same page as what that looks like, but our hands are tied. So we share in that frustration, Jackie.
I'm sure if you get locked up, we'll lock him up also.
Thank you.
Not in juvenile court, sir.
Further questions, comments? Thank you much. Hearing none, we move to Marie Spear campus.
Good morning. We've been making a little transition with the new building, so training is starting next week. So we have a lot of staff doing a lot of training, and not only kitchen, but the detention area. The Girls Open Unit have been volunteering at the Lenawee Medical Facility. Residents have completed a 3D printing course. I think we talked a little bit about CSI and the school and different things last time, but they finally completed their CSI. Residents have been working on flags in the community. We started a new substance abuse prevention education program during the school 2 times a week in detention and open unit. We did that in the summer school as well with Parkside. 25th, Lenawee on Aging will be moving into the new part of the kitchen, so we're excited about that. Obviously, I think you can see on the desk, we have the ribbon cutting on the 26th. And the kitchen will do a dry run on the 29th, so they're excited. And it looks like the first week of October, hopefully, we will be able to move into the detention area. Other than that, it's just been busy getting the last little things done around on the building. There's lots of little things that have been coming up. We're doing our punch list tomorrow and go through and try to get everything done that needs to be done.
You might want to explain for those that don't know, when you actually move in to the new unit, there's renovation that will be going on to the existing unit.
So yeah, so we'll move into the new part. And then the old part will get a renovation. So we're gonna replace doors, windows, plumbing, flooring, and a little bit of work on both of the day rooms, which is very needed and overextended. Obviously, I think everybody recognizes that, and that's why we're doing it. So it's gonna be a nice upgrade to that. And that will take until about April to finish.
I also just want to point out that renovation, a large portion of the majority of the portion of the funds will actually is a grant from Michigan Department of Health and Human Services, a juvenile justice infrastructure grant. The county is about the amount of $1.3 million. And the county will be putting forth about 500,000.
Questions, comments? Yes, Jack.
Can you give me an idea of how many residents are at the campus and the in-county versus out-of-county?
22 and 15 and 8. We have 15 out-of-county residents and 8 in-county residents.
Any questions, comments? Hearing none. Are there any updates or other business? Mr. Krasny.
Thank you, Mr. Chairman. I believe this is germane to this committee. I want to invite everybody and the public to Lenawee Boys and Girls Club this evening at 5:30 is their annual Blue Jean Ball, which is revamped a little bit this year and will be much more informal, and it'll be kind of a walkthrough of the building and facility and the program. So I want to invite everybody to see that terrific organization in our community. Thank you.
Thank you. Anything else? Any other updates? Any other business, Commissioner? I'm sorry.
Just moving down to are we ready for the overdose fatality team, or would you like to?
Go ahead, go ahead.
So Public Act 313 of 2023 allows or provides for communities or counties to establish an overdose fatality review team. And Ms. Palmani and Health Officer Hunt have been instrumental in gathering a list or a team of people to join this group. And what this group does is it takes people who have died by a drug overdose. They take that case and they bring people from the community and resources that were impacted, that had impacted this person's life. So for example, MDHHS or Michigan Department of Health and Human Services, abuse and neglect, the justice system, even sometimes schools and things of that nature. And they come together and they review the life of this person who unfortunately passed due to a drug overdose. The purpose is to identify areas where we can build more resources to prevent overdose deaths. And so there is a specific team that will convene when these deaths occur. However, they will also bring in more people that may have impacted this person's life throughout the span of their life. That information is then shared with MPHI or Michigan Public Health Institute, and they're the keeper of the information. These meetings are confidential and every team member will sign a notice or a confidential agreement prior to having those discussions. And that information will stay with MPHI or again, Michigan Public Health Institute for them to utilize that information to build and discuss those resources. MPHI actually will be coming down. We have just really got this team together. They'll be coming down very soon in the next couple months to do a OFR 101, if you will. And then that team will be established and we'll move forward reviewing these overdose deaths. So I just wanted to give an update on that Lenawee has established their team and that team will be moving forward with those reviews.
Questions? Doctor?
All three counties have an opiate review committee. And Sarah and our office primarily provides a lot of the information and statistics on death. A couple of them that I have attended, we have to be very careful of some of the statistics that are presented because people look at things differently. Some of them look at people, especially the youth, who have shown or been on drugs but did not die as a result of it. So it's becoming multifactorial, encompassing, trying to prevent drug usage altogether.
Thank you. Commissioner Van Dorn?
So does each county have one of these or are they joint for all three?
No, that's correct. Each county has their own team.
And who appoints this committee?
It's not necessarily an appointed committee. It's a group that there is in the statute in the Public Act, there is recommendations for people who should be a part of it. And we have followed that act in Lenawee County. But again, for example, when I worked in the juvenile courts, I attended we also have a group called the Child Death Review Team, which is very similar. When a juvenile or a child dies, a team gathers and reviews what happened in that child's life. So I had a juvenile or a child who passed. I had that juvenile on probation. So I was brought into that team to discuss what I had dealt with that family. It's very similar. So again, somebody who dies by an overdose, the team establishes, but they could actually bring in maybe their counselor or the child care worker that worked with this person when they were a juvenile within abuse and neglect or within the juvenile court to discuss what was going on in their life at that time, which gives insight into substance use disorder and overdose fatalities.
Further questions? Comments? Is there any other business to be brought to this committee? Any other business to be brought to this committee? Any public comment? Hearing none, I'll entertain a motion to adjourn.
Motion to adjourn.
Support.
Moving to support, is there discussion? Hearing none, all those in favor say aye.
Aye.
Those same sign,